Welcome to this presentation about recruitment of trainee pharmacists 2026-2027. The purpose of this recording is to provide information and support to current and prospective employers in the South East when developing multi-sector programs. The slides have been produced by the South East Pharmacy Workforce Leads, representing each integrated care system, with support from the NHSE Pharmacy South East WTNE team. During this session, we will provide an overview of the Foundation Training Programme for 26-27. We will also be discussing developing multi-sector programmes, including rotation options, supervision requirements, and multi-sector models. Finally, we will highlight recruitment timelines and support available. So the 26-27 Foundation training year will be very similar to the 25-26 training year. That is, it will incorporate the full new learning outcomes, including enhanced clinical capabilities and independent prescribing at the point of first registration. The GPHC has delegated responsibility for quality management of all training sites in England to NHSE as the statutory education body for England. All trainee pharmacists must be recruited through Oriel, National Recruitment Scheme. And Oriel is the key element of quality management of training sites. There will be no approval of training sites outside of this process by NHSE or the GPHC. No eligibility or mechanism for payment outside of this process. Funding of training sites has been now harmonised, so all training sites across all sectors will now receive a funding contribution of £26,500. General practice may be the lead employer for trainee pharmacists. And NHSC will be providing a consistent training course offer for all trainees. Historically, the pharmacy recruitment model has always been fragmented with huge variation in recruitment practices, leading to recruitment bias. For this reason, trainee pharmacists are now recruited through Oriel, which is a UK-wide portal for recruitment to postgraduate medical, dental, public health, healthcare science and foundation pharmacy training. So for 26-27 foundation training year, in accordance with the GPHC requirements, employers must ensure that trainees will have access to a prescribing learning environment, a dispensing learning environment. This is not a dispensing practice. A designated supervisor, who's normally a pharmacist with at least 3 years post-registration experience, and a designated prescribing practitioner, a DPP. This could be any prescriber meeting the eligibility criteria, does not have to be a pharmacist. Trainee pharmacists need to undertake a minimum of 90 hours of learning focused on developing and demonstrating the skills and capabilities of a prescribing practitioner under DPP supervision. The DPP does not need to directly supervise all 90 hours and may delegate to other appropriately qualified members of the healthcare team. It is actually recommended that trainees spend some of those 90 hours minimum with other members of the multi-professional team. It is also worth noting that there will be some graduates who enter the foundation training year who will not have graduated against these new learning outcomes and therefore will not be able to be an independent prescriber on registration. These would include some MPharm graduates who have started against the old learning outcomes and have had their learning interrupted, and overseas pharmacist students. These trainees will continue to follow the interim learning outcomes and will therefore not require a DPP and access to a prescribing learning environment as part of their foundation training year. In terms of supervision requirements, there must always be appropriate clinical and practice supervision in place to ensure that the trainees are working safely. A designated supervisor may supervise more than one trainee pharmacist, This has been a change as previously only one supervisor was permitted to supervise one trainee pharmacist. There is no longer a requirement for a designated supervisor to have a minimum of 28 hours over 4 days with the trainee. Where the trainee pharmacist has a multi-sector rotation of 13 weeks or more into another organization, there must be another named designated supervisor at the rotational site, or a designated prescribing practitioner. The planned approach for DS provision must be supported by clear job planning to ensure that the supervisor has enough time allocated to meet the requirements of supervision and assessment of the number of TPs they are supervising. I would also like to highlight the participation requirements for Oriel, and that it is important for designated supervisors to undertake some form of training, and there is current training that is commissioned by Pharmacists to support DS training. So multi-sector programs are defined as being of minimum 13 weeks in duration, up to maximum 26 weeks. This could be in a different sector of practice, such as an NHS-managed sector, which would include acute trusts and mental health trusts. It could be a community pharmacy or a general practice, including health and justice. When planning multi-sector rotations, it is important to consider the following. Are all training sites located within a reasonable geographic distance to the base site? Any information about travel arrangements for rotations should be provided within Oriel descriptors. For example, if there is availability or a lack of transport links, including public transport. It is also important to note that it cannot be advertised as a requirement that a trainee has a car, as this will not meet the EDI requirements for the advert. There are various multi-sector program options for trainee programs. And here we are highlighting some of the most common approaches. So the first option is having an informal multi-sector placement with a lead employer. In this case, the lead employer would recruit a trainee pharmacist, and as part of that 52-week program, the trainee will spend some time in a different sector. The time spent with that second rotation will normally be less than 13 weeks. And this could be anything between 90 hours, which would be to provide the practice learning time, to cover the prescribing learning competencies, up to about 12 weeks. During this time, trainees will still need to be under appropriate levels of supervision, although this may not necessarily need to be a pharmacist. According to the GPHC, a DS is not required if the placement is less than 13 weeks. So in this case, the trainee will need to be supervised by a designated prescribing practitioner if they are covering the prescribing learning outcomes. And this, as we said earlier, does not have to be a pharmacist. The second option is a formal multi-sector placement with a lead employer, where a formal multi-sector placement is defined being a minimum of 13 weeks, and this could range anything between 3 to 6 months. A third option is also a formal multi-sector placement where you could be the lead employer. And in this case, trainees could spend 6 months up to 9 months with yourselves, and then they would rotate to a different sector for 3 months. Multi-sector rotations are collaboratively organized by the lead employer and the rotation provider. The DPP and the DS roles can be filled by 2 separate people, or if it is a pharmacist who is also an experienced and active prescriber and meets the eligibility criteria, that pharmacist DS could also act as the DPP for that trainee pharmacist. As trainees will be going into a different sector, a placement fee can be arranged between organizations to host a trainee pharmacist to support supervision. For example, £1,000 or £1,500 funding contribution towards supervision of the trainee pharmacist may be offered. However, the amount offered depends on the employing organisation. It is important to note that for 26-27, organisations can still partner up with a lead employer, for example, a community pharmacy, to offer an informal placement. However, all programmes will require a formal multi-sector placement by 27-28. Therefore, from 27-28, all programmes will be of a minimum 13-week multi-sector rotation. We would now just like to share an example of a multi-sector model, which is a non-reciprocal arrangement. In this case, the lead employer in Sector 1 would submit the Oriel recruitment application. And as the lead employer, they would also receive the £26,500 NHSC funding trainee contribution. It is up to that lead employer to set and pay the trainee salary and develop the training plan with support from any supervisors who will be overseeing that trainee in Sector 2. The lead employer may provide a placement fee to support supervision in the second sector. They may provide the DS, which is a prerequisite as that lead employer. They will be spending at least 13 weeks in that sector, and therefore they, as lead employers, they will have to provide the designated supervisors. They may also provide DPP if that lead employer already has access to that prescribing learning environment. Sector 2 may provide access to a prescribing learning environment and DPP supervision or dispensing learning environment. So in this case, if we take community pharmacy as being the lead employer, then the community pharmacy may provide the DS. Now, if that community pharmacy is partnering up with a GP practice, that GP practice may be utilised to support access to a prescribing learning environment and DPP. If the first employer, the lead employer, is a GP practice will need access to a dispensing learning environment for that trainee. So in that case, the GP practice lead employer would need to support and link up with a community pharmacy, for example, as a second sector, to support with that dispensing learning environment for that trainee pharmacist. In that case, the GP practice would have to provide the DS and the DPP for that trainee. The second sector may receive a placement fee that would have been agreed with the first sector. If the second sector rotation is at least 13 weeks, they would also require a designated supervisor, i.e. a pharmacist, to oversee that trainee. The second model is a reciprocal arrangement, and in this case, each sector would employ a trainee pharmacist. Each sector would submit an Oriel recruitment application, and they would also each receive a £26,500 NHSC funding contribution for each trainee. It is down to each individual lead employer to set and pay the trainee salary and develop training plans to NHSC with support from the other sector. Each sector needs to provide a DS and may provide a DPP as appropriate. If there are these two separate training sites, each employing a foundation trainee pharmacist, and they agree to have these multi-sector rotations between the two sites, with foundation trainee pharmacists effectively being exchanged between the sites, for example, for a 13-week rotation or maybe even a 6-month rotation, then each training site would retain the full funding amount of £26,500. They might also agree not to exchange placement fees because effectively they would even out each other. It is also worth noting that with this model, there is no loss of trainees at each sector site, as that means each site will have a trainee pharmacist throughout the whole year. Tips around developing a multi-sector placement. So if you are newly embarking on this and not sure where to start from, the first thing we would suggest is, are there any existing networks in other sectors that you could build on? These could be, maybe, have you had any short placements previously for trainee pharmacists or undergraduate students? Maybe in a different sector like a community pharmacy or a GP practice in mental health. Have you had any other pharmacy professions within your organization that has had placements in other sectors, like pharmacy technicians and PTPTs? Maybe even post-registration rotations. Do you have any contacts from other sectors who deliver local induction and training sessions? It is also worth thinking about, are there any local hospitals? These could be secondary care organisations or community providers and community hospitals, community pharmacies or GP practices that would be interested in new partnerships. Factoring in other sectors, maybe prisons and health and justice. Trainees would be able to undertake a multi-sector placement. To answer this question, we would suggest that you have a look at your trainee pharmacist rota on whether you would like to have a gap or have a continuous trainee with yourselves for the whole year. As we mentioned previously under the reciprocal arrangement model, it might be worth considering having at least 2 trainees that swap sectors to ensure that you always have a trainee with you. This model is particularly popular with community pharmacy and GP split programs. How would you want the split to work? Would you like a 3-month, 9-month split? Or would you prefer maybe a 6-month, 6-month split? The minimum duration for a formal program, a multi-sector program, is 13 weeks. It is also important to factor in the time required for induction, annual leave and study days, particularly if considering a 3-month split. We would strongly recommend that the first 3 months of a foundation training year is spent with the lead employer at their base site. And it was also recommended that the last 3 months of the foundation training year, where trainees sit their GPHC assessment, is probably time where the trainee might be using up annual leave. So it might be worth considering the middle 6 months for any rotations. Would you like it to be a block placement or a split week arrangement? We have lots of experience in numerous models with block arrangements, whether it is a 3-month, 9-month split or even a split week arrangement, whereby trainees could spend possibly 3 days in one sector and 2 days in a different sector. This depends on your supervision requirements as well as the service requirements of your organization. What can a trainee pharmacist do? Having a trainee can help provide a sustainable workforce pipeline, and trainees can support with the day-to-day workload to your organization. This could be in contributing towards multiple cough indicators or CPCF services in community pharmacy. Examples could be things like hypertension, cholesterol control, and diabetes. Trainees can support with vaccination and immunizations, effective medicine reconciliation at transfers of care, including investigating queries, errors, and omissions, dealing with medicines-related queries from patients and colleagues, undertaking physical assessments with appropriate supervision, and they could also help identify topics for local audit and QI projects and participate in those chosen projects. We will now have a look at the national recruitment timeline overview. So Oriel is now open to employers for registering their programs for 26-27, and registration is open until the 1st of March 2025. During this time, employers need to enter their program information onto Oriel. Data cleansing then takes place within NHSE teams, where all the programs are reviewed and the number of training places are confirmed. This happens by the end of May, after which student registration opens in June, July, where future trainee pharmacists review those Oriel programs and start registering and completing their applications. During September-October time, assessments are held and preferencing window is open to trainees, which closes at the end of October. During this time, between June and October, prospective trainee pharmacists review program information based on your adverts and preference which programs they would like to select for their foundation training year. The preferencing window closes at the end of October, and placements are confirmed with students by the end of November and to employers by mid-December. So we just would like to quickly highlight what an Oriel advert looks like. And as you can see, this program is a multi-sector program between a community pharmacy, Chippenham Pharmacy, plus Medvivo in Chippenham, which is a GP practice. As you can see from this, it is very clear that it is a multi-sector program and it contains postcodes to both locations. This is further emphasized in the program descriptor, which again highlights what the trainees will be doing at each of the two sites. We've had several success stories of trainee pharmacists who had a very positive foundation training experience, particularly when it was a multi-sector program, and they have higher chances of getting filled. In this case, the community pharmacy trainee pharmacist had such a positive experience that they had some time spent with their local GP surgery, made connections, and as a result of this training, they can now see their future career as a community pharmacist. Finally, I would like to highlight support available. So there are a number of resources on Oriel and the employer handbooks, National Recruitment Scheme terms of participation. There are also some pages on the NHSE IETP reform pages, as well as implementing the Foundation Pharmacist Training Year site. So on this IETP site, there are a number of tiles that include information around how to get yourselves ready for the foundation training year, funding and frequently asked questions, information about the training offer provision, the NHSC practice-based assessment strategy, and training plan and guidance. Under the Getting Ready tab, there are further useful resources, including a video tutorial on how to submit a program on Oriel, prescribing supervision and assessment in the Foundation Trainee Program information, as well as information for training sites. Thank you for following this recording. If you would like some support or have any questions, please do not hesitate to get in touch with your pharmacy workforce lead within your area, which is shown on this slide. Thank you.